We've got up to 2 RF devices and 1 optical plugged in. I noticed that during our break, our young lady unplugged the Lamecca and plugged in the hair removal applicator. And so you get 2 options here. You get the Triton, which is like the Pico of hair removal. You get the Duo Light and Duo Dark that you can plug in here. This is your 755-1064. That is your Duo Light. That is for your light skin, dark hair patients. What about light skin, gray, blonde, and red hair? Well, then you're screwed. You're just going to be hairy and using depilators because nothing really works. But for dark, and I don't mean black, it can be brown or light brown. As long as you got a target, this will work very nicely. And so we hit our device. Up comes our parameters and settings. Now this is a bit different. This is a laser, not RF. We're going to be pre-cooling, pre-parallel and post, meaning we cool before we pulse. We then cool while we pulse, and we post-cool. And so I do what's called a very low energy, super fast, strong cooled treatment in the glide mode, and short pulse ratios of 30 milliseconds for skin types 1, 2, 3, 80 for 4, 5, and 6. We hit the ready button. We do a quick glide on every large zone, not small zone. We go right to more high energy. So typically, I'm going to take a pen. I'm going to shave to a stubble. She's got a lot of sun damage. She'd be great for photo rejuvenation of her lower leg. And let's say she has dark skin. I want to do her lower leg, which will take about 10 minutes to do, max. I divide it into 4 quadrants. And I do my glide mode quickly here, quickly here, quickly here, quickly here, before we do our slide mode. In glide, it's low energy, high speed, to kill some more susceptible follicles very quickly. So this kills the low-lying fruit. Then we go to a high-energy short pulse duration for the more challenged follicles. And typically, permanent reduction after 3 sessions is going to be in the 75 to 80% reduction after 3 sessions. And so in this mode, you protect the patient's eye, you protect the technician's eye, and we do the glide mode. So we activate. Where's the, there we go, pedal. We activate the trigger right here, and super fast, 5 pulses per second. I do 5 passes. Pass number 1, pass number 2, pass number 3, third pass in the zone. So it takes about a minute or 2 to do this ultra short treatment, which is low energy, high speed. Now that won't kill a lot of follicles, but it'll kill a lot and more than you think, the very susceptible follicles, but it won't kill all of them. I've now got to go to, come back to our machine, from our glide to slide. And so when we go from glide to slide, we're going to go way up in energy. This is 755, 810, and we're going to go upwards of 14 joules to 18 joules per centimeter squared. And we're going to go 1 to 2 pulses per second. Strong cooling is 5 degrees Celsius and 30 milliseconds. And we can treat that very safely at 755, 810. Now we're going to be treating this at basically 1 centimeter per second and 1 to 2 pulses per second in this slide and glide mode. This is 2 pulses per second. Hit the ready button. And so now we're going to do more high fluence treatment. Again, a little bit of gel, pre, parallel, and post cooling. Foot on the pedal, and you don't want to go too fast or you're going to miss some areas. And if she comes back at 2 or 3 weeks and says, I've got some patches where the hair regrew, you know you went too fast. And so we do a pass of high energy 755, 810 after our glide mode. You should smell the smell of burnt hair if there's dark hair. You should see a little perifollicular edema and erythema, carbonaceous, which is some explosion of the hair shaft, carbonaceous debris in the gel, and easy extractability of each of those shafts. I'm going to hand this off and go ahead and treat both sides there. Very simple technique, very fast. You need to be able to treat high zones, big zones, chest, whole body, man's back, full leg, forearm, axilla, groin, very quickly. The most common package we sell in the medical spa is total body hair removal in 45 minutes. All hair on your body come in and we'll treat between 30 and 45 minutes. For a woman, maybe it's the forearm, it's the axilla, maybe some androgynous hair, certainly bikini and a full leg. Man, chest, whole back. So big zones is where you get to compete with the trichologists who are selling like an armpit or a bikini for 25 bucks. You want to offer full body hair removal in a medically validated credential area where you can, your clinic, where you are offering 3 wavelength hair removal, where most other clinics can't do that. And so for many years, I ran my practice on the Gentle Max Pro from the now kind of vanished Syneron Candela. The problem with the Gentle Max Pro, it worked, but it would break down, wasn't always stable. So I had a very expensive maintenance contract, and I was spending thousands a year on cryogen. This does not need cryogen. I've got 3 wavelengths, not 2, 755, 810, and 1064. Like most things in mode, it never breaks down. It lasts forever and ever. So now you can offer high-speed hair removal. So continue to film, George. Let's go both sides now. PowerPoint, Charles. So this is like when the Pico launched. The Pico Sure took what was 16 tattoo removal sessions on my Rev Light to a picosecond pulse duration. Now I did 6, 7, or 8 for a tattoo. So half the number of treatments for a better result. 3 wavelength hair removal gets you twice the result in half the treatment. And again, that's all out of your Optimus Max. And so after 3 sessions, the FDA submission data is about 81 to 84% permanent reduction in 3 sessions, not 6 or not 5. Light skin, dark hair, that's 755, 810. What are we killing? We're coagulating the shaft to send heat out to the bulb and the bulge. And so we want to get the bulb and the bulge dead. This is a control side, untreated and treated, 755, 810, Duo Light. Duo Light, 755, 810, 75. I tell patients 50 to 75% reduction. I don't tell them 85%. And I take a iPhone photo with a phototrichometer, little bit of app and software to get the density of their hair before. So at the end of the 3 treatments, I can confirm the density after. I tell them 50% reduction in 3 treatments. Now it's often 75 to 80, but I tell them 50, under promise, over deliver. And again, this is a good reduction. And see that hair after? There's not much. And so that's successful. Even though the hair is not dead, we do 3 or 4 valuable things if it's not dead, and we'll talk about that. Man's back, you can do that in about 12 to 15 minutes, 755, 810. Darker skin, I would do 810, 1064. And rather than 3 sessions, I would offer maybe 4 or 5. I see this a lot in Toronto, Southeast Asian skin or Asian skin, and they've been treated at another clinic with a YAG. No 810, just a YAG. And then they don't have enough energy to kill all the hair, but it synchronizes growth or stimulates more growth, and they come back with their forearm or their face with more hair than they started, and boy, are they pissed off. So for Hispanic, Asian, Southeast Asian, sometimes this paradoxical hypertrichosis comes from undertreatment. The nice thing about the 810, 1064 for your skin type 4 and 5, you don't undertreat. You don't get this paradoxical hypertrichosis. It's not just a YAG, it's an 810 and a YAG in every pulse.